What is and how to treat generalized anxiety disorder, GAD? Generalized anxiety disorder, or GAD, is a common mental health condition in the USA, marked by chronic and excessive worry. It can interfere with daily activities and relationships. Treatment options include psychotherapy, medication, and lifestyle changes. Around 3.1% of the U.S. population, or 6.8 million adults, experience GAD annually. It is more prevalent in women. Despite its challenges, GAD is highly treatable like other anxiety disorders. Doctors diagnose GAD when anxiety lasts for 6 months or more. Symptoms may worsen during high-stress periods or physical illness. Emotional and cognitive symptoms include uncontrollable worry and difficulty coping with uncertainty. Other cognitive symptoms of GAD are intrusive thoughts, excessive planning, difficulty making decisions, trouble concentrating, and an inability to relax. Physical symptoms range from muscle tension to digestive problems and heart palpitations. Behavioral symptoms include an inability to relax, switching tasks frequently, spending excessive time on simple tasks, seeking reassurance, and avoiding anxiety-triggering situations. Children may show irritability and anger when anxious. People with GAD often have other conditions like phobias, depression, or substance misuse. The cause of GAD is unknown, but likely involves genetics, brain chemistry, and personality traits like neuroticism. A family history of GAD increases the risk, and differences in brain functioning and chemical imbalances are also linked to the disorder. Traumatic experiences can contribute, as can chronic illnesses and substance misuse. Women and individuals between childhood and middle age are at higher risk. Diagnosing GAD involves meeting criteria in the DSM-5-TR, including excessive worry for at least 6 months and difficulty controlling it. Symptoms must include at least 3 of the following: restlessness, fatigue, trouble concentrating, irritability, muscle tension, and sleep issues. They should cause significant distress and not result from substance use or another condition. Doctors may conduct a physical exam, take medical history, use psychological questionnaires, or order blood or urine tests to confirm the diagnosis. Treatment options depend on symptom severity and may involve multiple approaches. Psychotherapy, particularly cognitive behavioral therapy, CBT, is highly recommended for managing GAD. CBT is as effective as medication, with benefits lasting 6 months post-treatment. Other promising therapies include mindfulness-based and acceptance and commitment therapy. Medication options include antidepressants like SSRIs and SNRIs, which take weeks to work, and buspirone for reducing physical anxiety symptoms. Benzodiazepines may be prescribed temporarily but are habit-forming. Lifestyle changes can aid in managing GAD, such as regular exercise, a balanced diet, reducing stressors, and practicing mindfulness. Journaling can help identify triggers, and avoiding alcohol, drugs, and caffeine is beneficial. Setting a consistent sleep schedule to ensure 7-9 hours of sleep per night is crucial. Excessive worry affecting daily functioning or relationships indicates an anxiety disorder. Consulting a doctor or therapist is essential. Early treatment improves the outlook for individuals with GAD. Consulting healthcare professionals can lead to effective management and an improved quality of life. GAD is common but highly treatable with the right approach.